Very much. Let's bring in Dr. Ashish Jha, director of the Harvard Global Health Institute. Welcome back, Dr. Jha. Good to have you again this morning. That warning from Dr. Fauci is just so stark. What's it going to take to keep it from coming true?
Yeah, George, thanks for having me back. That is where we're heading. And there are things we can do right now. So first and foremost, I think we need every state to have a mandatory mask law. I just think we can't dither around on masks. Everybody needs to be wearing one when they're outside of their home. Second is I think we just can't right now afford indoor gatherings. So no bars. I don't even know if we can keep restaurants open, certainly not nightclubs. We've got to get very serious about that. And then we've got to keep pushing on testing and tracing, George. That's our third and one of our most powerful tools for keeping the virus under control. If we do all of that, we can avoid the fate that Dr. Fauci mentioned.
How about stay-at-home orders? You see both Governor Abbott in Texas and Governor DeSantis in Florida really resisting that.
Well, that's the last thing, right? If nothing else works, then you have to just essentially shut the state down. And I think all of us have been warning for the last 4 or 6 weeks that we've got to get on top of this, because otherwise we'll find ourselves with some very unappetizing choices. And stay-at-home order, in my mind, is really that last thing that you do when nothing else has worked.
We just saw those pictures of people out on beaches. Talk about the difference between the chances of getting COVID outside versus getting them inside.
Yeah, there's pretty good evidence at this point that it's much safer to be outside than it is indoors, which is why closing beaches has not actually made that much sense to me. Now, if beaches get super packed, that can be a problem. But if we can keep beaches from getting extremely packed, I think it's great to be outside. And I'd like to see people out on the beaches. I think it's relatively safe.
And of course, we're all hoping for a vaccine, hoping for it soon. Where are we on that right now? And what's it going to take to convince Americans that it'll be safe?
Yeah, so this is the thing. We are racing along. I think we're doing an unbelievable job. Nothing like this has ever been done in world history. We've got scientists around the world working on this. The key is, as you said, is that we're going to have to make sure that people know that it's safe. And the best way to do that is to run clinical trials with large numbers of people, including older people, including kids, so we know it's safe in those populations, and watch people for long enough to look for any bad events, adverse events that might pop up. If we sort of cut corners on those things, I don't think we're going to create the confidence people need. So I think we can get there, but we're going to have to do it. We're going to have to do it right.
Dr. Jha, thanks very much for your time this morning.
Thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.